When a policy, a process, or even a place doesn't fit quite right, do you ever wonder for whom it was built? One of the most powerful policy conversations I ever experienced wasn't in a polished boardroom or across the oak table of a university seminar room. It happened in a modest community center. There were flickering fluorescent lights, worn linoleum floors, and some really uncomfortable chairs arranged in a circle. And in that circle sat peoples whose stories rarely make it into policy briefs. They were individuals that were part of the social assistance program. And on that day, one by one, they began to speak. They spoke of the challenges of having to fit their needs, their lives, into the rigid boxes of the system. They spoke about the humiliations of having to prove that they were poor enough to qualify. They spoke of the small victories, like making it to the end of the month and having enough money for fresh fruit for the kids. They spoke about the hours spent waiting and those crowded service centers, the torn number in your hand, hoping that today was the day that your file moved forward. They spoke about the rules that made sense and some that just did not make sense at all. They spoke with a clarity that cut through the noise, like truth held up to the light. I walked into that room thinking I was there to gather feedback, and I left humbled by their expertise. Of course they knew the program best. They lived it. They carried its weight in their bodies, in their lives, in their families. At that point, I'd been working in policy for about 5 years. I knew the jargon, the abstractions, the concepts, but often it's exactly that that keeps us disconnected from real lives and real consequences. And that day rewired how I think about policy, and it planted a transformational idea in my mind. What if we could change the world just by changing who holds the pen? Imagine living in a world where the rules, who gets to lead, what happens, was just not built for you. Where every hallway was built for someone else's stride, every opportunity for someone else's future. That world is not fiction. It's a world that many walk through every single day. Because policy isn't neutral. It decides who belongs, who gets listened to, and who gets left behind. Policy is storytelling. And too often, the storytellers are peoples who don't represent the populations they serve. Research from Catalyst tells us that the more diverse voices you have at the table, the more engagement you have, and subsequently more innovation. When more people have access to the pen, everything gets better. Performance, creativity, humanity. I saw this in a Canadian hospital when they were looking at reviewing the discharge instructions for patients, and they asked an Indigenous nurse to review them. She looked at it and quite quickly added a sentence that she asked to all of her patients. Who in your community should we involve in your care? That simple sentence respected cultural caregiving traditions, and the number of readmissions from Indigenous patients to that hospital dropped. A whole line of care was changed because an Indigenous nurse was given the pen. So I ask you, who gets to write Canada's next chapter? Because that question decides how each and every one of us in the room tonight walk through this world. Policy decides what we're paid, how we're cared for, whether we're supported. Policy decides what our kids learn at school, and if we ever really feel like we belong. Policy just doesn't define what is possible. It quietly defines for whom it is possible. So imagine shifting things. Imagine the people most affected by policy at the center of that circle. not as tokens, but as co-authors. People with lived experiences making decisions about power, about opportunity, resources, and rights. It's not just fairness, it's transformation. Look at our cities. So many of them were built decades ago by men, for men, often without a single woman at the planning table. And when you start to see that, the evidence is everywhere. You're walking home late at night, keys clenched in your hand. The sidewalk ends just as the streetlights do. Or you're trying to access a building with a stroller or in a wheelchair. And you keep on moving, you adapt, you try other options, you try to get through, but you can't. Because you were never the default. Because safety and accessibility were never part of the blueprint. Inclusion in urban planning is not a luxury. It's about survival. And take workplaces. So many workplaces, male-dominated industries, policies that were built without women, and especially women of color, in mind. It left them underprotected and overexposed. We endanger a woman on the factory floor when we give her too big protective equipment and it slips and fails her. Or we injure a caregiver who's given a workstation that was built for a man's reach and strength, and it forces her to strain her bodies in ways it was never meant for. Or we abandon an LGBTQ employee when the harassment they're experiencing daily does not have a name or a way to explain it because the policies were written years ago. Workplaces quietly decide for whom they were built and who they weren't. Now take healthcare. Imagine this. You're perched in a hospital exam room on that paper that crinkles every time you move. You're scared. Your heart is racing, your chest is tightening, and you're trying to find the words to explain what you're feeling and what you're experiencing. A clinician walks in and almost too quickly says, "Don't worry, it's nothing." And every fiber in your body is telling you it's not nothing. And a wave of loneliness comes over you because you're not able to put into words what you're experiencing. Each of us in the room are going to live this experience at some point in our lives. Afraid, vulnerable, hoping that someone on the other side will understand what we're trying to say. The vast majority of medical research has been done on white men. And so somebody's nothing might very well be your everything. The consequences have been devastating. We misread a Black man's chest pain as anxiety, and only later learn it was a silent heart attack. We lose a rural teenager because the disease that they have is very treatable, but becomes deadly because the emergency room is hours away. Health policy decides who gets to recover and who doesn't. And take technology. It might be our most powerful policy tool of all. But algorithms inherit the bias and reinforce the assumptions of those who built it. We discard the resume of a newcomer because the system only recognizes what it has seen before. Or we misidentify a Black woman as a security threat when facial recognition software misidentifies her face to that of a stranger. Or we refuse an application from an Indigenous loan applicant because the system has been taught to trust postal codes more than people. This is not a glitch. It's what happens when the same hands keep holding the pen. Now here's the hopeful truth. Systems that have been designed to exclude can be rebuilt to include. When diverse voices design cities, schools, healthcare, technology, we can counter the bias. When lived experiences sit along technical expertise, we can build better systems, better communities, and healthier spaces. Inclusive technology can allow us to know health risks earlier for women, improve diagnoses across populations, and ensure healthcare in remote communities. This is leadership. Not to slow innovation, but to guide it. Not to treat inclusion as an afterthought, but as a part of the design principle from the very beginning. Because when we share the pen, we write better policy. We build healthier systems, better communities, and a future where progress belongs to everyone. Now here's the part that matters most. Each of us in this room tonight can influence it. If we want policies that build people up, instead of leaving them to feel unseen, unheard, unsafe, or unimportant, we can start with a few simple steps. Step in and speak out. Silence is the oxygen of exclusion, and your voice can cut through it. Ask who is at the table. Accountability starts with that question. Share lived experiences. Stories spark empathy. They ignite urgency, and they illuminate blind spots. Fourth, demand accurate data, because when we use biased numbers, we build bias into the system from the very outset. Amplify marginalized voices. Inclusion is not symbolic. It's something we do purposefully and intentionally every single day. We share the platform, we shift the spotlight, we pass the pen. And sixth, listen. Not to defend, to reply, to explain. Listen. Listen to what discomfort, to what silence, to what lived experiences are trying to teach us. Because listening is where humility lives and where real change begins. You can transform the world by changing who holds the pen. So I'm going to bring you back to that modest community center with the flickering fluorescent lights. And that question has remained with me ever since that moment. Whose story are we telling when we write policy? And who will hold the pen next?